Hey, future RN. Antibiotics are one of the most tested medication categories on the NCLEX. We're talking classes, side effects, and that all-important patient teaching. So today, we're going to break it all down so you can walk into that exam and answer these questions with total confidence. Welcome to ClearPath NCLEX. And that's what this channel is all about, giving you that high-yield, need-to-know content that helps you pass on the very first try. So let's get you ready. So here's what we've got on tap today. First, we'll dive into the major antibiotic classes. Then we'll get into the really crucial side effects and what you need to be monitoring. After that, we'll cover essential patient teaching, and we'll finish up with a quick NCLEX practice drill to really lock in that knowledge. So what are antibiotics, really? Well, at their core, they do one of two things. They either kill bacteria, which we call bactericidal, or they stop bacteria from growing, which is bacteriostatic. For the NCLEX, you really need to nail down the major classes, how they work, their side effects, and what you're going to teach your patients. All right, let's jump right into it. This first section is all about those major classes you are almost guaranteed to see on your exam. Okay, so look at this table. Don't let it overwhelm you because there's a really cool pattern here. See how penicillins, cephalosporins, and vancomycin all do the same thing? They all inhibit the bacteria's cell wall. Then you've got this other group, macrolides, aminoglycosides, and tetracyclines, that all inhibit protein synthesis. And the last two have their own unique jobs. If you can remember these groupings, it's a huge shortcut for answering NCLEX questions. Okay, now for the section the NCLEX absolutely loves to test: side effects and monitoring. This is where those tricky safety and priority questions come from, so let's really focus in here. Okay, this is super important. No matter what antibiotic we are talking about, you need to have two big risks in the back of your mind. First, a super infection, like C. diff, which leads to that awful watery diarrhea. And second, the risk of an allergic reaction. These two are always on the table for any antibiotic. And speaking of allergies, let's talk about penicillins. They are kind of the poster child for antibiotic allergies. This also highlights a key concept: cross-sensitivity. If your patient has a penicillin allergy, there's about a 10% chance they could also react to cephalosporins. You can bet the NCLEX loves testing that little safety point. Now for the heavy hitters, what I call the red alert side effects. For aminoglycosides, think toxic to the kidneys and ears. That's nephrotoxicity and ototoxicity. For fluoroquinolones, the big scary one is tendon rupture. Tetracyclines, think photosensitivity and teeth staining in children. And with vancomycin, you're on high alert for red man syndrome and, just like aminoglycosides, nephrotoxicity. So what does this mean for us as nurses? It means our monitoring has to be on point. We are checking renal function, so BUN and creatinine, for drugs like aminoglycosides and vancomycin. We're assessing hearing and balance for that ototoxicity risk. And for every single patient, we are looking for signs of an allergy, like a rash, and asking about that severe watery diarrhea that screams C. diff. All right, let's switch gears to patient teaching. This isn't just a high-yield topic for the exam. It's what keeps our patients safe when they go home. You can think of these as the 4 universal rules for any antibiotic. Number 1, and this is so important, you have to finish the entire course to prevent resistance. 2, take it exactly as prescribed. 3, call right away if you get severe watery diarrhea. And 4, immediately report any signs of an allergic reaction, like a new rash or trouble breathing. Then we have our special teaching alerts for specific classes. For tetracyclines and fluoroquinolones, you need to warn your patient to stay out of the sun. They can get a bad sunburn. Also tell them to avoid taking these with things like milk, antacids, or iron because it'll stop the drug from being absorbed. And for cephalosporins, a big one is to avoid alcohol completely. Phew! Okay, that was a lot of information. How about we see how much of it's stuck? It's time for a quick NCLEX practice drill. You ready? First question for you. A patient on gentamicin is reporting ringing in their ears. The nurse recognizes this as a sign of which adverse effect? I'll give you a second to think about it. And the answer is ototoxicity. Gentamicin is an aminoglycoside, and that ringing in the ears, or tinnitus, is a classic sign that the drug is causing ear damage. All right, next up, which instruction is the most critical, the most important for a patient prescribed ciprofloxacin? Think back to those red alerts. The correct answer is to report any heel pain or swelling right away. Ciprofloxacin is a fluoroquinolone, and their biggest, most unique risk is that Achilles tendon rupture. That's a major safety issue. Okay, last one for the drill.
Your patient is getting IV vancomycin and suddenly develops flushing and a rash on their neck and chest. What is your priority action as the nurse?
Your priority is to slow the infusion rate. This looks scary, but it's likely red man syndrome, which happens when the vancomycin is pushed in too fast. It's not a true allergy, so slowing it down should fix the problem. You guys did awesome on that. Okay, let's pull everything together into one final, simple cheat sheet. This is perfect for a quick review or to screenshot for your notes. Here it is. For penicillins and cephalosporins, think allergy risk. For aminoglycosides, remember the little saying. They're a mean old mycin that hurts the kidneys and ears. For fluoroquinolones, that floxin ending can flow right into the tendon and rupture it. And for absolutely all antibiotics, remember C. diff and that you must finish the full course. Listen, I know this can feel like a lot, but here's the thing. Antibiotics are so predictable on the NCLEX. If you can master the key side effects and teaching points we covered today, you are going to absolutely crush these questions. You've got this. Thanks so much for watching. If this helped you, please give it a like and subscribe for more high-yield NCLEX content. Oh, and hit that bell so you never miss a new tip. And I'd love to hear from you. Drop a comment below and let me know which antibiotic class you find the trickiest. I read every single one. You're doing amazing. Keep up the hard work, and I'll see you in the next one.